Good day, everyone, and welcome to the first episode of the webinar series Unbottling the Truth, brought to you by the UP Manila National Institutes of Health Health Promotion Program. Today's topic is understanding the link between alcohol consumption and mental health. My name is Lloyd Christian Esteban, and I'll be your moderator for today. In this webinar, we'll be taking a deep dive into understanding the important and complex relationship between alcohol consumption and mental health. We know that alcohol consumption can have a serious impact on physical and mental well-being. But what exactly are these effects? And how can we help individuals troubled by alcohol use disorders get the support that they need? Our esteemed speaker, Dr. Rafael Henry Legaspi, will guide us through this topic today, focusing not only on the challenges, but also on the available support that can help those affected reclaim their mental and physical health. For everyone's guidance, this webinar will begin with a short presentation, which will run for about 30 minutes. Afterwards, we'll move on to a quick Q&A session. Unfortunately, since this is pre-recorded, we will not be able to answer your questions immediately. However, we will be compiling your questions from the comment section and responding to them after a few days through email. Now it is my honor to introduce our speaker for today, Dr. Rafael Henry Legaspi. Dr. Legaspi completed his residency in general adult psychiatry at the Philippine General Hospital in 2021 and graduated from the same institution in 2023 as the first ever locally trained addiction medicine subspecialist in the country. He is a distinguished physician and health expert from the PGH Department of Psychiatry and Behavioral Medicine and acts as the Assistant Secretary of the Philippine Addiction Specialists Society. He brings with him a wealth of knowledge in both alcohol consumption and mental health. And today, he will discuss the intricate connection between the two, as well as the available support for individuals with alcohol use disorders. Dr. Legaspi, without further ado, the floor is yours.
Everyone. Once again, I'm Dr. Rafael Legaspi of PGH Addiction and Recovery Medicine and the Philippine Addiction Specialist Society, here to give you my talk on understanding the link between alcohol use and mental health. I have no conflicts to disclose. And here is an outline of my presentation. We'll talk first about alcohol use and mental health conditions generally, and then about the locally available treatment options for alcohol use disorder, and then screening and early detection, and most importantly, mitigating the impact of alcohol use on mental health. So for alcohol use and mental health conditions, first, let's talk about alcohol, what it is and what it does. So alcohol is a sedative hypnotic, or more colloquially termed, a depressant drug, which can disrupt the balance of neurotransmitters in your brain and affect your feelings, your thoughts, and your behavior. So alcohol affects that part of the brain which controls inhibition. So you may feel relaxed, less anxious, and more confident after a drink. But these effects quickly wear off, and then the chemical changes in your brain can soon lead to more negative feelings, such as anger, depression, or anxiety, regardless of your initial mood. Alcohol also slows down your brain processes and how you process information, making it harder to work out what you're really feeling and the possible consequences of your actions. In the long term, alcohol uses up and reduces the number of neurotransmitters in your brains, but you still need a certain level to ward off anxiety and depression. This can make you want to drink more to relieve these difficult feelings, which can start a cycle of dependence. Now, alcohol problems and mental ill health are closely linked. Research shows that people who drink alcohol are more commonly or more likely to develop mental health problems. It's also true that people with severe mental illness are more likely to have alcohol problems than the general population. This may be because individuals can self medicate, meaning that they drink in order to deal with difficult feelings or symptoms. The three categories of alcohol related disorders are the following: alcohol use disorder, alcohol induced disorders, and then co occurring alcohol use disorder and psychiatric disorders. First of all, let's talk about AUD. So AUD may be diagnosed using the following criteria, which bear in mind are used during the psychiatric or clinical interview and need to have been present within the last 1 year for the diagnosis of a current alcohol use disorder to be made. So, four criteria under impaired control will not go through each of these criteria. Three under social impairment, two under risky use, and two under pharmacological criteria. One very important criterion which must be fulfilled is that there has to be some form of dysfunction present, whether it's a reduction in your performance at work, inability to perform your responsibilities at home or at school. Now, a person only needs to fulfill two criteria for an alcohol use disorder to be diagnosed. And if they have six or more symptoms, which qualifies as a severe alcohol use disorder, they may require inpatient rehabilitation. Again, these criteria, even if they are widely available online under the Diagnostic and Statistical Manual of Mental Disorders, are meant to be used and applied during a clinical interview. So let's leave it to the specialist to diagnose alcohol use disorder, but we'll talk about some screening tools for early detection later. Now let's talk about the second class of alcohol-related disorders, which are alcohol-induced disorders. So looking at this long list, you can see that it's not just alcohol intoxication or yung kalasingan and withdrawal or yung paghanap ng katawan sa alak, right? But also a whole host of other disorders that may be caused by alcohol consumption, such as delirium, psychotic disorder, mood disorders, including depression and bipolar disorder, as well as anxiety disorders. Dementia can also become apparent in an older individual using alcohol, and amnestic disorder or yung pagiging ulilyanin due to the use of alcohol can happen in younger individuals. Also included in this list are alcohol-induced sleep disorder and alcohol-induced sexual dysfunction. So we see that alcohol affects our brains and our bodies in many different ways, and it's important to take these into account whenever we are consuming it. For the third kind of alcohol-related disorder, we have the co-occurring alcohol use disorder and psychiatric disorders. So rates of psychiatric disorders are high among clinical and community samples of alcohol-dependent individuals. Alcohol dependence is moderate to severe alcohol use disorder. So 4 hanggang 11 criteria bale ang na-fulfill nila. So the relative risks for different types of disorder can vary by sex at birth. So among women, comorbid anxiety and mood disorders are most common, whereas among men, comorbid drug use disorders and conduct disorder may be most apparent or most common. This is a table drawn from Tasman Psychiatry, published in 2024, which succinctly shows the leading psychiatric disorders which are comorbid with alcohol use disorder. So, according to the disorder classification, among substance use disorders, it is nicotine and cannabis dependence or moderate to severe use disorder, which most often co-occur with alcohol. So that's quite the combination. You're already drinking, you're also smoking, but you also can have cannabis use disorder or other drug use disorders. Under personality disorders, most comorbid with alcohol use disorder are antisocial, but also borderline and schizotypal personality disorders. Under the depressive disorders, we have, of course, major depressive disorder, but also bipolar disorder with depressive aspects. Under anxiety disorder, it's panic disorder with or without agoraphobia, as well as social phobia co-occurring with alcohol use disorder. And for the psychotic disorders, it's the perennial favorite, schizophrenia. So individuals who use alcohol are more prone to develop symptoms of schizophrenia. And vice versa, schizophrenia individuals diagnosed with schizophrenia can also have a propensity to overuse or drink too much alcohol. Bear in mind that um, the relationship is not unidirectional, so it's bidirectional. So alcohol use can induce these disorders or can mask the symptoms of these disorders, thereby delaying their diagnosis. But also, having these disorders can also increase the risk of you being more prone to use alcohol for uh, reasons of symptom reduction or even for socialization. So after talking about what alcohol is and its mental health effects, let's see what our options are for treatment in the country. So treatment varies by setting, first of all. So there's inpatient settings, outpatient, and then community settings. For inpatient settings, oftentimes we do receive referrals for individuals with alcohol use disorder, which who need detoxification first. So they need to be admitted at, for example, Ward 7 of PGH in order for them to stay for 2 weeks to 1 month in order for their alcohol withdrawal symptoms to be treated before they are transferred to a long-term rehabilitation facility for 6 months or more. For example, the DOH, Drug Treatment and Rehabilitation Centers. So some centers will not have the capacity to treat individuals who are in severe alcohol withdrawal, which can manifest as seizures, right? So it's better to have them at PGH or at a big hospital to make sure that they are safely detoxified from the last bit of alcohol that's left in their bodies. For outpatient settings, we have outpatient detoxification. So it's not impossible to reduce and gradually reduce and eventually become abstinent from alcohol just on outpatient basis. It's more challenging, of course, because it's not in a controlled setting. The patient is free to drink whenever they wish to. But with outpatient detoxification, you have the benefit of weekly therapy sessions as well as medications to help with the reduction of cravings and also the symptoms of withdrawal. We will discuss medications in the next slide. There is also intensive outpatient rehabilitation. So for individuals who are, for example, have moderate to severe alcohol use disorder who are really supposedly candidates for inpatient rehabilitation, but they are the breadwinner of the family, so they have to keep working. If they have a comorbid medical disorder, which requires also follow ups with their own doctors at, for example, PGH OPD, these individuals, although they have uh, alcohol use disorder that's severe enough for inpatient rehab, sometimes logistically it's just not possible. So we do intensive outpatient with them. So still 6 months at least of follow-ups, but these follow-ups come thick and fast, as in up to 3 times per week. Sometimes we have to do virtual checkups, but at least once a week face to face, and then the other ones can be virtual, uh, just so that the patient is followed up on or checked up on. So all of these inpatient and outpatient um, modes of treatment are available at PGH. For community settings, so 12-step programs or recovery groups, you might have seen these in movies or in a traditional media. So, hi, I'm Rafi. I'm an alcoholic, right? That's how traditional media portrays them. Those are meetings for fellowships within the Alcoholics Anonymous or Narcotics Anonymous, which are groups of individuals who have banded together to help each other through the process of recovery. So 12 steps refers to the step work that they have to go through from the first step to the 12th step. And then the last step is when you invite someone or become a sponsor for someone in that group as well. So they being part of the group keeps them accountable, right? Being part of the group gives them a community of people who accept them unconditionally. And that is something that you just don't get automatically at the hospital, right? We are trying to set up an Alcoholics Anonymous group within the hospital. We just need a space for them to meet. Pastoral counseling is also available and faith-based services. So inquire at your local church or sa um, wherever you go for Sunday service. Depends on the location, of course, but there might be available some faith-based services as well. After talking about the settings, let's go to the actual medical management. So when you look at the textbooks and even online, there's a lot of meds that are being shown are shown there to be useful for alcohol use disorder. However, these are some of the few that are available in the country. So for withdrawal symptom reduction, we have gabapentin, which is an anti-epileptic drug also used for pain, for neuropathic pain sometimes. It is helpful for sleep. That's why we give them to individuals who are undergoing a mild to moderate withdrawal so that they are able to sleep and to reduce the tremors, right? Because when they get the shakes, they feel like they have to drink in order for the shakes to go away, for the tremor to go away. But when they use the gabapentin under medical supervision, of course, they find that alcohol is not the only cure to the sickness, kumbaga, to what they feel when they are without it. Uh, Anti-craving medications are also available, so we are glad to have only very recently come into the Philippines, naltrexone, maybe 1 or 2 years ago. This is a mu opioid receptor antagonist, so it's FDA approved for alcohol use disorder and opioid use disorder. So it has been shown in studies not only to reduce cravings but also reduce the number of drinks taken per drinking session. Topiramate, which is also an anti-epileptic drug, and olanzapine, a antipsychotic, are both used off-label to help reduce cravings as well. So in areas where naltrexone is not available or merong libre na topiramate or olanzapine sa health center, yun po yung gagamitin natin because it's far more cost-effective and still shows good results. So not just medical management yung available sa atin, we also have psychosocial interventions. So motivational enhancement therapy and cognitive behavioral coping skills therapy are the bread and butter of the addiction specialist or the psychiatrist who specializes in seeing addiction patients. So these are all about providing a motiva MET. First and foremost is about providing a space for the addiction specialist and the patient to work collaboratively towards increasing the level of motivation of the particular patient who wants to change their behavior. So it's very egalitarian, right? The patient is the expert. Kumbaga, even if you call yourself the addiction specialist, the one you're talking to is the one with the experience of being in or having this substance use problem. So you respect their experiences as well, and not just the ones that you have heard from your patients or you have read in your books. But this is a very structured therapy as well and manualized. So motivational enhancement therapy. CBT, CST, or just CBT with coping skills therapy is a particular flavor of CBT which was developed or shown to be particularly useful for people with alcohol use disorder. So it's not just talking about how your feelings affect your thoughts affect your feelings, affect your behavior, but it's also about learning actual coping skills in therapy so that you're able to avoid the people, the places, and the things that cause you to drink alcohol. 12-step facilitation therapy, as the name implies, draws heavily from the principles of Alcoholics Anonymous and the 12-step movement. So it's like an add-on. It's like a supplement to going to your recovery meetings. You also have therapy with your addiction specialist so that the points talked about during each of the 12 steps are brought home. And lastly, last but not the least, a very promising therapy for addictions is interpersonal psychotherapy. So it has been piloted in the US on women with moderate to severe alcohol use disorder with co-occurring major depression with good results. The fellows at PGH Addiction and Recovery Medicine we're also exploring having them trained in IPT specifically to add to their armamentarium. So this is a very good, promising therapy. Now, after finding out that there are locally available treatments, how do we know when to come in or when to bring our loved ones for treatment? So, one very simple and well studied screening tool is called the CAGE questionnaire. C for cut down, A for annoyed, G for guilty, and E for eye opener. You only need two yes responses to the four questions to indicate that there's a possibility of alcohol use disorder, which should be investigated further. Right? So if you say yes to two of these four questions, it might be time to see your psychiatrist or addiction specialist, right? But these are medyo mabigat siya, di ba? Felt that you have had to cut down on your drinking, annoyed about being criticized about your drinking, feeling guilty about the drinking, and lastly, seeing it as an eye opener, right? Pampagising. Yeah, you know some people like these, right? The people who have to drink in the morning because they're hungover. So it becomes a never-ending cycle of being drunk and then having to be drunk in order to not feel hungover. Um, a Another one, another questionnaire which has been translated into Tagalog is from the WHO. It's called the Alcohol Use Disorders Identification Test or audit. So audit F is the Filipino version. It has 10 questions. A score of 8 or more indicates hazardous or harmful alcohol use. So itong mga columns na ito po are rated from 0 to 4. So 0, 1, 2, 3, 4. And then you have 10 questions. They have the questions inquire about kung gaano kadalas ka umiinom ng inuming nakakalasing, asking about how many drinks do you take, gaano kadalas yung marami yung iniinom mo in one sitting, may times ba na hindi mo mapigilan yung pag-inom, may times ba na nabigo kang gawin yung ang mga responsibilidad mo bunga ng pag-inom, meron bang times na yun, eye-opening again, uminom sa umaga, and then gaano kadalas makadama ng pagsisi. So there's that guilt component again. For 8, nakalimot ka na ba ng ano the way I explain this to my patients is nag-black out ka na ba, 'di ba? Were you so drunk that you blacked out and you couldn't remember what you did the previous night? Number 9 is nasaktan ka na ba or may ibang nasaktan bunga ng pag-inom? And mayroon bang mga nagsabi sa iyo or nag-aalala about sa iyong pag-inom at nagpayo sa iyong tumigil. Right? So these mirror the DSM or Diagnostic and Statistical Manual criteria for alcohol use disorder. But they are in a self-report questionnaire. So kaya-kaya tong sagutin ng regular person without the help of their psychiatrist or a doctor or even a trained health professional. So again, per item, the score is 0 to 4 depending on your answer, and then a total score of 8 or more is considered to indicate hazardous or harmful alcohol use. So alcohol, while we often see alcohol or parang traditionally it's seen as a way to unwind, right? Like we previously mentioned, it really can have a major impact on our mental health. But the good news is there are ways to minimize these effects and make informed choices that support our overall mental well-being. So a good deal of attention needs to be placed on the matter of changing habits or lifestyles in the interest of recovery, or even if you want to cut down on your alcohol use, right? The following areas are most relevant. So nutrition, exercise, and hobbies, right? Meron akong hindi na-mention dyan, yung spirituality, but we'll talk about it also at the end. So nutrition is all about the balanced diet, avoiding unnecessary or junk calories, including those in alcohol, right? Kaya nga merong San Light, di ba? Kasi nakakataba yung alcohol. And even individuals who say na, Dok, hard lang yung iniinom ko, eh, tumataas pa rin yung sugar nila. Di ba? Tumataas pa rin yung cholesterol nila. So really, alcohol is just excess calories when you think about it from a diet perspective. So if you have been drinking alcohol for a long time and have been actually been losing weight, you might want to consider correcting nutritional deficiencies and seeing a nutritionist if you have recent unintentional weight loss. For exercise, so ask yourself what kind of exercise can you begin to do on a regular basis that is 3 times per week, right? And something sustainable, something not too heavy. But in order to reduce your alcohol consumption, you can schedule a workout during the weekend. So this discourages any heavy alcohol consumption at the end of the week. Or pwedeng hindi ka na lang mag-workout, di ba? Depende yan sa'yo, depending on how motivated you are, right? But if you're really into the working out and regularly working out, your body will sort of look for it as well. Well, we used to talk about exercise as a positive addiction, right? Because it's something that your body sort of needs, right? That's why people sort of get quote unquote addicted to marathons or even triathlons. You know, it feels good when your body is moving. Diba? So you are incentivized to move to exercise. So once you get into the habit, you may prioritize exercise above your weekly binge or yung inuman session, right? Because it sucks to exercise when you're hungover. You know, it's almost not worth it, right? So set specific exercise goals for yourself. For hobbies, so first of all, habitual alcohol use sort of shrinks your lifestyle, you know. Over the course of the habit or the illness, you lose or abandon old friends, old hobbies, interests, activities, and so on. So life becomes progressively more centered around alcohol, obtaining it, hiding it, using it. So parang ano no, parang strange that you're treating alcohol as if it was an illegal drug, right? But in individuals who really have a severe alcohol use disorder, they have to hide their alcohol use. Otherwise, papapagalitan sila ni Mrs. Right? So, in early sobriety, when you're just starting out to cut down or when you're trying to cut down, the relative emptiness of the recovering person's life drives them back towards drinking out of sheer boredom. Right? So, delikado yon kapag naboboring ka, di ba? Kailangan mong something na magawa. Umuulan, di ba? Walang pasok, baha, gano'n. Ano gagawin mo? Iinom ka na lang, 'di ba? Kasi wala kang magawa. That is where hobbies come in, right? So, hobbies are what you used to do for fun before alcohol came along. May ibang tao naging hobby na nila yung pag-inom, 'di ba? You could count it as a hobby din, 'di ba? I like to drink with my friends. I like to drink. I am known as someone who drinks a lot. It becomes part of your identity. The same way people are sort of married to their hobbies, right? I like to play pickleball or you know, I'm a football player or whatever, you know, something that keeps you going, keeps you motivated. So ask yourself, what did you used to do for fun before alcohol came along? And what in the activities in particular interest you, right? So you set specific goals for sober recreation and fun. Yes, with family and friends, right? You exercise with your wife, you go out on family trips with your kids and extended family. Also important to have something that is just for yourself, right? So individuals I have a lot of patients, usually male patients, who sort of treat alcohol as the one thing that they have just to themselves. Para siyang sagrado. This is the one thing that my wife cannot tell me to change or whatever. It's something that I do with the boys, 'di ba? Find something else, 'di ba? It's important to find something that is still fun, but it is parang clean living, kumbaga, that you can enjoy while you're sober. So it is not impossible, although you might need help from your therapist or even from your family and friends to find that particular hobby. Not mentioned in this slide, but also quite important. Quintessentially Filipino is the practice of some form of spirituality, whether it's going to your church in any major religious denomination, or even just a personal practice of spirituality through meditation or yoga or whatever form your spirituality may take can be helpful in dealing with the slings and arrows of an unpredictable life. You know, that bit of you that is not just of this earth. That's something that you can get in touch with using spirituality. So in the end, it is the choices that we make daily that determine whether we get meaningful results when we want to change. Remember still that the less you drink, the lower your risk. This also applies to the mental health effects of alcohol. And when in doubt, consult your friendly neighborhood addiction and recovery medicine specialist, or a psychiatrist, or your pastor, or your priest, or your barangay captain, or that friend who's always inviting you to the recovery group meetings. The bottom line is help is available, and most of it is free, at least to start. So thank you very much for your kind attention. I just want to plug our Division of Addiction and Recovery Medicine. That's the link to the PGH online consultation request and appointment system. So if you do feel like you need help with alcohol or other substances, even behavioral disorders, right? Gambling, internet gaming, hypersexual disorder, we are the ones to call, right? Or you can go to someone who is closer, more accessible, right? But that is a free option right there in front of you. So again, thank you very much. Here are my references, and I look forward to the Q&A.
We just have a few, actually, some prepared questions for you to go around to go through for our Q&A. So you mentioned a bunch of early warning signs on early detection for alcohol use and mental health issues. So we go now to how sorry, most of the interventions that you talked about, or most of the things that you talked about, were more individual. I noticed that they were a little bit more individual in nutrition, exercise, hobbies, living sober, essentially, and spirituality. So I think I'd like to ask if uh you as a person noticed someone in your circle, whether it be a family member or a friend, or how can these people, your family members, your friends, best support somebody or someone they know who may be struggling with both alcohol and mental health issues?
That's a good question, and it's a question I get a lot, right? So, when approaching someone who you may feel is having difficulties reducing their alcohol use, or when it's affecting their life in a negative way. By negative way, it doesn't have to mean like they've hit the proverbial rock bottom, right? You don't need to hit rock these days. You don't need to hit rock bottom in order to merit treatment or even a consultation, right? But if there is even a dip in the performance, example, a student who is no longer performing well, right? Or a parent who is no longer able to take care of their children to the level, right, that they want to do it, that's already a marker of dysfunction. So it's important to
Mhm.
point that out to these individuals in a neutral, right, in a non-judgmental way, right? I noticed that you haven't been doing too well in your studies, right? Is there anything that we can do for you, right? Or
Mhm.
is there anything that you are having trouble with? It's important that they also volunteer, right? Na para, ano kasi, medyo napapadalas yung pag-inom ko ngayon. Parang hindi ko mapigilan yung sarili ko, parang kailangan ko ng alak para makatulog. It's important that they volunteer such information instead of you imposing it on them na meron kang problema, right? Because they already know that. They already feel quite shameful about their behavior sometimes. They don't need you to emphasize that further. So we
Mhm.
need to be neutral, we need to be non-judgmental, and use yung mga objective na mga ng mga bagay, bale example grades, 'di ba? Or yung pag-fulfill ng certain responsibilities or work performance, right? Rather than something personal, 'di ba? Na ikaw kasi ganyan ka eh, 'di ba? O
Mhm.
parang what would your mother or your priest say about that, right? So avoid moralizing. So the best thing we can do is to meet people where they are, right? To talk to them in a neutral way, bale. And then you tell them that may libre naman na assessment, right? Sa PGH or somewhere, for example. So it only costs them their time, right? And I've had patients who were so negative about seeking help, right? Sometimes we have to conceal the fact that I'm an addiction specialist. Pwede na parang, kasi maraming comorbid, di ba? So
Mhm.
meron siyang alcohol use problem and then may depression din siya.
Mhm.
So we train our fellows at PGH to treat not just addiction, but also yung mga not so complicated na mental health issues. So you start
Mm-mm.
seeing your specialist about your mood problem or your anxiety, and then you segue into the conversation about alcohol use disorder. So may konting finesse na kailangan.
Mm-mm.
So let us not use the morality as like a bludgeon, 'di ba, na para to guilt people into seeking treatment because it rarely works.
Ayun po. That's actually a great point, no, Doc Legaspi. I was actually going to segue into that since you mentioned needing neutral ground. So we were going to actually, the next question actually was going to segue into how possibly people in your circle or you yourself, if you were the one experiencing these addiction or these alcohol use and mental health issues, on how you go about dealing with the stigma surrounding seeking help or the health seeking behavior in itself, the person's willingness, and in this case, how can this be possibly overcome? So you've mentioned, so in your earlier response, you talked to us kung paano tayo natutulungan ng community natin, how you as an individual, knowing somebody that may necessarily be going through these things, how can they best approach it? So siguro, I think this question could focus more on how you, if you were the one going through this, being self-aware na siguro at this point to go through or to overcome these particular challenges.
All right. So we do get referrals of impaired health workers, right? So individuals who practice their craft, practice medicine or nursing or other allied health na field, but are under the have substance use problems and other behavioral addictive disorders. So first of all, it's okay to admit that you have a problem, right? Because uh, help is there, help is available. Mas mahirap kapag inadmit mo na may problema ka tapos wala makakatulong sa iyo. But actually, the expertise is slowly getting more and more bali yung mga practitioners. So, self-awareness is only one piece of the puzzle, right? So even if you tell yourself that, "Yeah, I know this is bad, or I know this will not be good for me, bale, the the leap from contemplation to action, kumbaga, in the stages of change is still that. It is still a leap, and you may not be able to do that on your own. Sometimes it takes, just having someone to talk to about your problems to
Mm-mm.
sort of concretize them. If it's all abstract in your brain, di ba? Na hindi mo siya, you never actually got to sit down and then write down your thoughts about it or do parang exercises or homework with your therapist, hindi
Mm-mm.
mo siya makikita kung gaano kalaki yung problema, right? So, uh, self-awareness can only take you so far. And it is possible to stop cold turkey, right?
Mm-mm.
Mag-stop ng yosi. Alak, siguro pwede rin, pero not if you've had seizures in the past, di ba? So please don't
Mm-mm.
stop cold turkey kapag nagka-seizure ka, pag tumitigil ka, go see a specialist, right? So it's not impossible to stop them on your own, right? But sometimes if you've had multiple relapses, it can be quite disheartening, right? Try to do it on your own. Maybe this time around, your chances would be better if you had someone to help you out, right? So, doctors and other mental health professionals or professionals in general, right? They don't want help because they feel like they have it under control. The truth is, the moment that the substance enters your body, or even when you see it pa lang, di ba, bumubula pa lang yung beer, yung shabu,
Mm-mm.
nilalagay pa lang sa foil or whatever, yung marijuana, niro-roll pa lang. Those cues pa lang, pag na-notice mo na yon, nakita mo na yon, the substance is in control.
Mm-mm.
You are not in control, right? So a bit of humility will get you a long way, right? Even with smoking, 'di ba? Smoking is so innocuous. O parang may vape naman, 'di ba? Hindi naman ang daming doktor nagve-vape, 'di ba? O nagyoyosi, right? But it's really the substance that's in control even if you feel like kaya ng motivation mo, right?
Mm-mm.
So the minute that you accept na hindi ikaw yung in control because it's the chemical, right? That's when you will get that spark of inspiration na parang, yeah, maybe I can't do this on my own.
Okay po. So thank you for that, no, Doc Legaspi. So Segueing into our next point here, I'd like to ask if there were any possible success stories or any insights that you could possibly share about individuals. Of course, your discretion naman po, at your discretion on any individuals that have possibly successfully overcome both alcohol use disorder and mental health challenges, and probably to help guide us through what best helped them overcome these particular challenges in their life.
So I had patients in the past with multiple severe drug use disorders or substance use disorders and then comorbid, for example, anxiety, right? So what helped them was, first of all, they're on medications, right? To help with the anxiety. So they're on an antidepressant. Antidepressants also help curb cravings. So it's not just antipsychotics, also antidepressants, right? So in the treatment of the anxiety or the depression or what have you, uh, the antidepressant or the antipsychotic na binigay also helps reduce the cravings, right? So it's a double whammy, kumbaga.
Mm-mm.
So nababawasan yung symptoms ng anxiety, so they feel like they're able to sleep without the alcohol, right? But also because they're taking the meds every day for 6 months, 1 year, sometimes more than that, right? Nare-reduce din yung cravings nila for the substance. Eventually, when their life gets a bit better, right, they're better able to problem solve, cope with stress because they're on their meds and they're on therapy. They are better able to say no to the substance and say yes to taking care of themselves, right? So, yes, addiction, and even more so, yung may comorbid na addiction and um, mental health condition, bale, are challenging cases, yes. But they really are the rule rather than the exception. Minsan
Mm-mm.
lang ako may pasyente na pure tobacco, ganun. Pure tobacco use disorder, diba? Or pure alcohol use disorder. Right? There's always there more often than not there's an underlying either an underlying trauma, an underlying depression or something like that. Right? So um it is possible and very doable to get success with patients, yeah, even with comorbid substance and uh, mental health conditions. What's important is that you detect it
Mm-mm.
early, right? So you're not just forcing them to stop drinking without giving them an alternative, 'di ba? Yung antidepressant niya yung alcohol, tapos tinatanggal mo, 'di ba? So ano
Mm-mm.
mangyayari? Aalis siya, hindi siya papakita sa iyo. But if you were a good enough listener, right? You ask the right questions, na-detect mo na, meron pala tong MDD. That's what's causing them to drink so much alcohol so that they can sleep or so that they can forget their problems. Nabigyan mo siya ng antidepressant. Di ba? Umokay yung depressive disorder symptoms niya. They feel like they need to drink less or not at all even. Right? So, it's very important yung detection dito. So, it's
Mm-mm.
not just using the diagnostic criteria or the screening test for alcohol use disorder, but also being sensitive to these other symptoms, right? So that you treat the whole person, right? The person with an addiction is more than their addiction, right? So you
Mm-mm.
need to listen to everything that they have to say.
Ayan po. So thank you for that, Doc Legaspi. So you mentioned that so we've talked about early detection, signs of support that we can gain or we can do or render ourselves as members of the community or somebody struggling through these particular alcohol use and mental health issues. So you mentioned also segueing into the latter part of your presentation about free modality that people can avail of if they wanted to set a consult or an appointment with to see a specialist on addiction and mental health disorder. I'd like to ask if there was a way. So what are probably I think the steps moving forward? So after they've gotten the consult, if there were any support programs that were offered to them by the specialist or by the physician that they saw, how could somebody possibly enroll themselves in these support programs if they wanted to pursue, and if ever there's like a ballpark figure of how much it would essentially cost if they were to engage in the support program?
Are you talking about yung 12-step,
Yes
right?
po.
Rather than yung consults
Yung,
kasi at
yes,
PGH libre naman yung konsulta.
yes po.
So yung mga recovery groups, um I double check their website eh. Ito parang hindi gumagana yung website nila right now, but it should come online again soon. Ang daming AA na groups naman kasi.
Mm-mm.
So Alcoholics Anonymous Philippines, aafilipinas.com, if I remember correctly, is the website for Alcoholics Anonymous where you can sign up or at least see kung merong mga online na sessions
Mm-mm.
that you can attend. They even have yung actual addresses ng mga centers, right? For example, I once referred patient sa Bukidnon kasi sa Bukidnon sa Malaybalay merong Alcoholics Anonymous sa Malaybalay, Bukidnon
Mm.
sa capital. So it's possible to refer people even sa Mindanao, right? As long as andun sa site nila which has been updated naman regularly. I just need to check with them kung bakit hindi gumagana yung URL right now.
Opo.
So that so online pwede nilang i-check, right? Uh, within PGH, we're still trying to get a space nga for our Alcoholics Anonymous na group. We're already talking to the leaders, right? We have a good relationship with the leaders of Narcotics Anonymous who are also involved in Alcoholics Anonymous, so that we can find as organize bali a group para sa PGH. No need to tell people kung saan siya mismo, right? They will
Mm-mm.
find out pag nagpagkonsulta sila sa amin. But it's free. In
Mm-mm.
order to join a group, you just need to show up to the meeting. Pwede kang mag-donate ng konti for the snacks because the snacks are free. So lagi may kape, may biscuit, 'di ba? Something like that. So it's on a willingness basis balik kung magkano yung ibibigay mo, right? So at unfortunately at PGH wala pa tayong ganyan na group but we're working on it,
Mm-mm.
right? We have a fellow who is one of his main jobs is to make that happen, right?
Mm-mm.
But there are options either online or face to face within the metro and even in surrounding areas. We just need to wait until the website comes online again. Vale.
Okay po. Ayan po. So thank you for that, Doc Legaspi. So I think siguro this question stemmed from the sentiment na majority of the people of course asking for consults or probably the programs or the medication that comes after. Usually ang nagiging main factor talaga na inaalala nila is of course yung socioeconomic na brunt or yung
Mm-hmm.
burden na madadala niya, no. So with that being said, you mentioned sorry, referring again to the plug that you mentioned about the link for the OPD or for the to set a consult. If ever was there or is there a hotline possibly that if in terms of urgency or if ever there was somebody that may not necessarily have access to internet connection that would necessarily want to talk to a specialist for this
All right.
particular
Yeah,
disorder?
that's a yeah, good question. I forgot to mention this. So the hotline hindi pa namin siya na set up. Maybe in the coming years, right? Because that's going to be a national hotline, right?
Opo.
So we don't have enough fellows to man the hotline just yet. But uh, if the patient, for example, is not able to access the internet, they can still go to PGH OPD and go to room 301. So room 301 sa PGH OPD is the psych OPD. That is where addiction medicine also lives right now for now.
Mm-mm.
There is always Monday to Friday there is a senior addiction fellow on call.
Mm.
So, kung gusto mo mag-walk-in, pwede ka mag-walk-in. Kung hindi kaya ng schedule ng fellow kasi meron kaming didactics, iba, or magpapa-rounds ako sa kanila or whatever,
Mm-mm.
uh, ang gagawin is they will schedule you the next day, right?
Mm.
So, we put that measure in place so that we would not lose yung mga referrals na same day binigay sa amin, right? So,
Mm-mm.
nakita ng psych, refer to addiction at titingnan agad para hindi na so they don't have time to change their minds, right?
Mm-mm.
So seen agad. So there is an option to just walk in
Mm-mm.
to PGH Psych OPD room 301 and then the nurse will get your details, right? They will text the fellow who is on call and if he or she is indisposed, they will either schedule you in the afternoon or the next day. So that's part of the duties ng aming senior fellows, bale.
I see. So talagang masasabi natin na the fellows right now genuinely have their hands full talaga, and especially when there are new referrals talaga, the influx of people that they need to go through talaga are very
It's
very.
fine, pumunta lang sa ng PGH, pumunta lang kayo ng PGH, trabaho yun ng fellows. And of course, they get better. They get even better the more patients they see.
Actually.
So, even if I have to supervise so many referrals, that's fine with me. All
Opo.
right. But what's important is that, makita yung mga kailangan tingnan. Kung hindi naman kailangan yung follow-up na matindi, eh
Mm-mm.
bibigyan ka naman ng less frequent na follow-up. So it's perfectly doable naman.
Opo. Ayun po, Doc Legaspi. So, you've given a very comprehensive overview of the presentation, basically running us down through what mental health and alcohol use disorder, their connection, possible support systems, steps that people can take both individually and as a community. I think this is more so an open space question of if there is something that you'd want to say to people struggling with alcohol dependence at this particular point in time.
So to anyone watching this and wondering whether they should seek treatment or not, right? It it only takes again what two criteria dun sa DSM to be diagnosed with even a mild alcohol use disorder. For example, sinabihan ka na ng partner mo na or ng doktor or someone else saying na nakasasama sa katawan yung alak or nakakasama sa mental health, right? One
Mm-mm.
na yon agad. And almost everyone will fulfill that criteria. Unless they are totally disconnected from the world, people will know alcohol is bad for you, right? And then if for example, meron kang craving or if dumadami yung pag-inom mo ng alak, right? Or if you've experienced na nagka problema sa trabaho, right? Or napagastos sa alak, kahit
Mm-mm.
isa lang doon na na-fulfill mo na isa, na extra. So that's already two. That's already an alcohol use disorder, right? We are not trying to pathologize alcohol use, right? It will be a fact of life that Filipinos, even into the future, like to drink, right? But if you notice that something needs to change, right? If you're having these blackouts, if you're having severe hangovers and you can't go to work, right? That's a sign of dysfunction na. And it might be time for you to seek help, right? The sooner the better. Again, the less you drink, the lower your risk. You will never decide to drink less if you do not accept that something is going on, di ba? Something wrong is happening, right? So it might take a professional to really show you the data and explain to you in a neutral way, in a non-judgmental way, that stopping drinking is the way to go, right? So we'd rather that makita kayo agad rather than i-continue yung because we've had patients na sad to say na nawala, 'di ba? Nagkasakit severely at namatay dahil hindi sila natingnan ng addiction medicine at in our infancy, right? There were referrals that we were not able to see agad-agad for whatever reason, right? Or hindi sila nagpakita sa amin sa follow-up. And then the next time I saw the patient, nasa ER na siya and beyond the help na, right? And I would like to think na kung natingnan siya ng addiction medicine, at least may kakampi siya, 'di ba? In trying to stop the substance use.
Mm-mm.
So, a mind is a terrible thing to waste, right? And alcohol really affects your mind in sometimes negative ways. Might as well get help and get treatment as soon as possible. And if you don't have a problem, at least yung doktor yung nagsabi sa'yo na walang problema instead of
Mm-mm.
trying to deny it, right? So, ano, we are very good with being neutral, with being collaborative, with being respectful to to our patients. So please, we would rather see lots of people and then send them home right away or just give them every month na follow-up. Then mamiss namin yung iilan, 'di ba, na kailangan talaga ng every week or twice a week na follow-up. So, again, you know, uh, the alcohol is in control. You are not in control.
Mm-mm.
So get help. If you feel like, your life is your life could use it, 'di ba? If your life would be better if you reduced or stopped the alcohol.
Ayan po. So thank you po for that, Doc Legaspi. I'm sure that people that will watch this webinar recording of us will definitely, siguro not everybody, but probably hopefully a majority of them would probably resonate, no? Even if it's not necessarily regarding alcohol dependence, just genuinely if people are struggling through things in their life at this time, probably what you mentioned will definitely resonate naman with them. Siguro to cap off our Q&A session for today, I'd like to ask if you had any final comments about today's discussion or anything else that you'd like to mention that you probably remembered that you'd want to plug or to segue into for the discussion today.
I just wanted to thank, NIH, HPP, Syntax Coalition, everyone responsible for making this happen. We rarely talk about alcohol use disorder, and it's Mental Health Month, no? So pahabol,
Mhm.
pahabol na webinar about alcohol and mental health. Alcohol use disorder is a mental health condition, right? It's not just addiction lang yan, right? It really is has a potential to have negative consequences, right? Addiction is a brain disease. It is a treatable brain disease, and the treatment is here, right? All you need to do is get in touch, right? We might not be able to cater to everyone all at once kung sobrang dami yung pasyente, but at least andyan na may first contact na, bale, ba? Nasa listahan na kayo ng triage nurse namin.
Mm.
So we will be able to get back to you as soon as we can. So I hope this webinar bears even more fruit. Episode 1 pa lang to,
Yes po.
right? Sana sa November, maybe not this year, next year, 'di ba? Ibigyan naman ng ibang specialist ng kanilang time. But sana next year, let's talk about just addiction lang. 'Di ba? Not just addiction and mental health,
Yes po.
comorbids, right? But purely addiction na webinar on alcohol. That would be great. Since
Mhm.
November, 1 week in November is Drug Abuse Prevention and Control Week. And still alcohol is one of the major drugs of abuse in the country. So once again, thank you to the organizers, and I look forward to our division and also for the Philippine Addiction Specialist Society to be involved in your future endeavors.
Yan po. Maraming salamat po for that, Doc Legaspi. I do have to say that that was very well said. So just a brief reminder, of course, for our online participants, given that they're viewing this recorded webinar. For anybody listening or watching online, you can more than freely address your questions in the comments section so that we'll be able to compile them and forward them to Doc Legaspi and his team for their reference and so that they'd be able to provide answers to your questions at a later time. So, with that being said, I think that formally brings us to the end of today's session. On behalf of the UP Manila National Institutes of Health Health Promotion Program, we would like to thank Dr. Rafael Henry Legaspi for sharing his valuable insights with us today. We also extend our gratitude to everyone who submitted questions during this webinar and join the conversation. As we continue with our Unbottling the Truth webinar series, we encourage everyone to stay tuned for our next webinar episode next month, which will tackle alcohol and road safety. Remember to follow our social media pages to know more and stay updated on future events. Thank you, everyone, and we look forward to seeing you in our upcoming episodes.